I'm David Mickel, as you might have guessed. I'm recovering from man flu, so if you see me about to cough, cover your ears. We're not insured for accidental hearing loss. Uncle Andrew. I'm just going to give you some basic background information on Mickel Therapy, where it came from, how it was stumbled across by accident, what it is, what we treat, and then we're going to have about half an hour for questions. I think we have a mic here because I won't be able to hear you. Can you hear up the back? Good. So, my background's in general practice medicine, which I did for 5 years. It was awful, but paid the bills. During that time, I met a lovely girl with ME, chronic fatigue syndrome, and I went through 2 years of pretty much hell and frustration with her because of her illness, because as a doctor, as I'm sure you know, we have all the answers. Well, I didn't. So we went to a series of alternative practitioners, you might call them. We tried everything. I even remember driving her to an appointment with the consultant psychiatrist who suggests she might be depressed. My ear was ringing for 3 days following that. In actual fact, she was quite right, because these are not psychological conditions, as we're about to discover. Now, I'm pretty simple as a person. Well, no, I'm not simple. I like to keep things simple. So I started to attract a lot of people with chronic fatigue and ME and fibromyalgia, that kind of spectrum of illness. And they used to come in to me, and it didn't make any sense to me how these people were generally pretty happy people. Yeah, but they felt awful. So I thought maybe it is psychological. Big mistake. So I went and trained in hypnotherapy and psychotherapy and started trying to apply those techniques to people who had it in a clinic after my work. And the only thing that happened was people used to leave my room happier but just as ill. Well, what Mickel Therapy does, and you better write this down, is we take unhappy, ill people and make them well but unhappy. Now I'm going to explain that more in a moment, because there is a transition in the treatment where you have to discover what is at the root cause of the symptoms, and they're not what they appear to be. So anyway, I'm looking through all these symptoms, and I realised suddenly that people who get these conditions, it affects every single physiological part of their body. Everything. Head, muscles, bones, joints, guts, you name it, everything. Now, in my simple anatomical kind of training, I know that there's one place that controls everything in all of us, and that is this gland called the hypothalamus. Now, before the ME Association write to me, or the GMC, I say I have absolutely no proof for this, but according to our clients, the treatment works, so I might be right. So what I thought happened was I based the treatment on the fact that the hypothalamus was going too fast. Literally, what happens is that makes your body work, and work. All the systems, all the time. It makes the immune system go haywire. It makes the stomach respond to fresh air as if it's poison. It makes the muscles not contract, but chemically work even when you're sleeping, so you never get any rest. And people who've had the condition will know you go to bed, you sleep for 10 hours, excuse me, indigestion, and you wake up like you've ran a marathon. So, I think, right, so if the hypothalamus is going too fast, why is that? Now, to start with, what you do as a doctor is you try to make symptoms go away. Yeah? That's the whole of medicine's about making symptoms go away. So I tried that, and that didn't work. So I thought, what if we try and get more of them to understand from? So I started to suggest to people, it was a little bit risky, but I had good medical defense at the time, was I'd get people who were fatigued to go and do something fun. And quite often their symptoms would improve. Well, this didn't make much sense to begin with, until I started to explore further that what we're talking about that affects the hypothalamus in the first place is a build-up of activity in an area in the brain called the midbrain. Now, this can get really complicated, and I'm going to get trouble off my team practitioners if I make this not simple enough, is that what we're talking about is literally there's a part of us that has an emotional reality that is out with what our head thinks. Does anyone understand that? basically what it means is while you walk into a situation, your head can be telling you this is good, but there can be another part of you that says, no, it's not. And we call that the body-mind intelligence. So there's a split between what our head tells us and what our body knows. Now, only recently I found that there's actually scientific evidence for this, which came as a huge relief, because I stay quite near Findhorn, which smells a lot like out there at the moment, whereby people, you go about talking about the body having intelligence, you're allowed to, but you do it in conventional medical circles, you're getting ready to become this way, Dr Mickel, the jacket won't be too tight. So, I definitely doubted my own wisdom here, but I stuck with it, and I discovered that the body does send emotions that we don't even know are there. So the effect of that is because they don't go anywhere, they immediately stimulate the hypothalamus, and this happens all our life until suddenly the hypothalamus gets stuck going too fast. Does that sound likely? Thank you for your encouragement. No, sorry. Yep, sorry. Good, thanks. How's your arm? The hypothalamus is a pea-sized, very unlikely gland in the middle of the brain that is basically, its job is to keep everything in balance, all our systems. So it sends out signals to all areas of your body and it gets feedback about what should happen. So it changes things. Well, in the state of hypothalamitis, as I called it, and I have no proof for that, is that in chronic fatigue, ME and fibromyalgia, the switch-off mechanism stops. So it keeps going fast. Yeah? Now, what we found, and this happened by mistake, I've got to say, I treated 7 people over a period of a year back in 1999, and I didn't tell anyone it was working because I couldn't believe it myself. But what started was I started to find a technique whereby you can teach people to recognize what these emotions are coming from the body and what they want that person to do. Now, the ridiculous nature of them is they're often very trivial. Because these conditions are not psychological, when you look briefly at when symptoms start in a person's life, it's very rare that you find big issues happening. That's why it's not psychological, which really, and this is one of my bees in my bonnet, is the current recommended treatment is a psychological treatment for depression. And the studies show it don't work, but they still recommend it. And I'm sorry if the CBT professor from wherever it was that wrote to me is here. So, the technique of Mickel Therapy is basically very simple, but not always easy to apply for everyone. That I would say. Although it seems to be getting much easier. And what happens is we explore the onset of symptoms with someone, and we try to work out if the body could speak instead of sending symptoms, what would it be saying? Now, it might not come to your surprise that it's talking about the emotions it sent and what it saw happen to them. So we start with that for a very short period of time. The person goes away with what we call a message, and they use it. Anytime the symptoms increase, they read it, and it says, my symptoms are here to tell me blah, blah, blah. They work with that, and they get more clues. Now, if they want to get better quickly, they keep notes. Very short ones, because we're aware that fatigue and brain fog does not exactly encourage you to keep notes. So they come back to the practitioner with notes, and the practitioner is trained to go through them to get further clues before moving on to the next step. Now, this, I don't know why it happens, but what does happen is the hypothalamus seems to gradually go back to a normal rate. Now, as that happens, the symptoms reduce, and then stop, in most cases. So, to our surprise now, we've got 90 practitioners across the English-speaking world at the moment, and France and Holland, is that we've treated. Now, our results are based on the feedback that we have from people who've been treated. Nothing else at the moment. That's why we're volunteering ourselves to be studied in the form of a trial. Which gets a bit frustrating because if you listen to the media recently, the ME associations, for some reason, really